experts are considering adding more hospital data to the state's reopening criteria. Our Jessica Taylor spoke with physicians who work in ICUs to learn exactly what's going on inside.
I wish it was the flu. I wish it was something that wasn't as severe and life-threatening as it is.
Idaho remains in stage 4 of Governor Little's reopening plan, but these doctors say that doesn't mean things are under control.
Idaho is averaging around 500 new infections per day, which is very high. I want everybody to remember that. About 6 weeks ago, there was on average 20 some odd new infections a day.
To advanced stages, the state looks at criteria, including the number of confirmed cases, amount of PPE, and how many ventilators are available.
We're trying to use other measures like high flow nasal cannula to prevent people from going on ventilators. So I no longer feel that using ventilators as a measure of, yes, we're in a bad state, or no, we're not in a bad state.
Dr. Hahn says that's not one of the new criteria or data they'll be collecting.
I don't believe we're collecting information on use of high flow oxygen from the hospitals, to my knowledge. We still are collecting the ventilator data.
It also explains why there's a gap between the current case numbers and death count.
People, typically are on the ventilator for weeks. So ultimately, that's why the case numbers go up weeks before the death numbers go up.
The physicians both say they have capacity in ICUs to care for anyone who comes in. But if trends continue, that will change. These two see the coronavirus and its side effects every day and want to remind the public how serious the situation still is.
It's heartbreaking to see, especially when patients are it's unclear whether they're going to get better or whether they're going to die of this disease.
Jessica Taylor, Idaho News 6.
St. Luke's also monitors patients remotely, which helps with care and capacity issues. St. Luke says it can take a week before stable patients start to worsen or see severe symptoms. Telehealth solutions allow those patients to spend that time at home instead of alone in the hospital.
What we're able to do now is actually discharge patients to their home, where they can isolate, quarantine at home. And they have an iPad where they answer questions about how they're feeling. They have a pulse oximeter measuring their oxygen levels in their blood.
The data is closely monitored, and physicians and nurses are available 24/7. The tech also helps keep more hospital beds open.